Hello and welcome to Alive to Thrive OT. I'm Lauren Lyman.
And I'm Tracy Schnabel.
And today we're going to talk to you about total knee replacements. So basically why you might need them, the decision-making process, how to prepare for them, and what to expect afterwards. So we are two occupational therapists. We did notice a bridge in the gap of healthcare, but today we are actually going to really focus on the OT aspect. And I feel like one of the gaps is actually that people aren't prepared for their knee replacement or hip replacement surgery. So we want to have a couple videos just to say like, hey, this is what's going to happen and this is what you should expect, so that when you sign up for your elective surgery, you know what you're getting into and you know how to prepare for it and you know how to set things up at home so that things are easier for you. So first, a little bit of a disclaimer. This is for informational purposes only. This is based on our professional expertise and opinions, but if you have any specific medical concerns, we recommend that you consult your doctor. We do not give out warranties or representations, and proceed at your own risk. And if it's a medical emergency, hang up and call 911. So Tracy, why do people need knee replacement surgeries?
Okay, so one of my favorite things to do is tell people why they need something or what's going on behind the scenes. So this is actually really interesting to me. So with knee replacements, it's, osteoarthritis is happening, but everybody throws that word around, OA this, OA that. But what is OA? DOA, have you ever seen the show? Okay, sorry.
Well, first let's talk about like what people tend to think osteoarthritis is.
Yeah.
Oh, my doctor says I have bone on bone. I need surgery. That's what people think severe arthritis is, bone on bone.
So it's the breaking down of the cartilage in the knee, and it's progressively breaking down to where, so this is kind of what the knee looks like. If you look like this is the femur, and then the tibia is at the bottom, and then here's the joint, okay, as we're moving, yeah. So there's a covering over that, and it's actually your cartilage. Same thing with the shoulder, right? So there's a covering over the cartilage of the shoulder as it rotates into the joint. That cartilage helps kind of let it glide easier. So progressively over time, that starts to degrade. But why is it degrading? Your doctor won't talk to you about that, most likely. Maybe a really good one will get into it. But what I discovered is that it's because the cartilage, it has too much pressure on it. So sometimes like when we're overweight and we're putting so much stress on it, it's just not able to support that and it starts to break down. So like losing weight could actually really help reduce your risk of getting a knee replacement. Or if you have, mild to moderate arthritis, you might want to consider something like that, like getting a weight reduction program versus getting a whole artificial replacement. It also has to do with foods. Arthritis, we talk about in other videos, is connected to food. So sometimes your body is degrading because it's pulling away from the body because it doesn't have the nutrients it needs to build. So your body is constantly breaking down muscle tissue, cartilage, everything, and building it back up again, depending on what you do every day and what you eat every day. So if you want to have positive results, you put in good things and don't take out more than you're putting in. So, and a lot of research I did on arthritis, because so many of my patients had arthritis, and I felt bad. I'm like, I got to be able to tell them something to do. I'm sick of telling people, you have arthritis, sorry, you have to get a knee replacement. You have to just live with the pain, and you just have to live with disability. So I did a lot of research, and I found out, no, you don't. It's just like a lot of other conditions. Like I said, it's nutrition related and it's activity related. So, when you're putting in more, it helps. So you need those green leafy vegetables that are high in boron. They actually really help rejuvenate your immune system. So instead of an autoimmune disorder is arthritis, the body is it's attacking itself. It's not normal for your cartilage to be breaking down and your body to be attacking itself. So instead of it being broken down, it should be building up. If it's breaking down, that's because you have a lack of nutrients and you need to put that in the gap. So also we have a whole food nutrition product that does that if it's difficult for you to incorporate it into your diet. But you should be incorporating, a salad every day, those green leafy vegetables, if you have arthritis, to help build that gap and decrease it from degrading further and further and further away. So a lot of people with OA have, now I don't want to say everybody has poor diets, but they're lacking some nutrients. potentially.
And I think a huge component of arthritis that's overlooked, because I know, we know, okay, the wearing away of the cartilage, and we're starting to get to the point where diet is being mentioned, but a whole nother component of arthritis is inflammation.
Yeah.
So, some people, and I hate that x-rays are always used because it's harder to see cartilage on x-rays. X-rays are meant for bones.
Yeah.
So, I mean, how can you tell how much cartilage I have from an x-ray? I'm not a doctor, but I don't depend. I wouldn't want to depend on an x-ray to tell me how much cartilage I have, because cartilage is not a bone. But inflammation is an issue that causes arthritis as well, and that's one that's being overlooked. So if you have inflammation in between your joint, like Tracy was showing, you have your joint. If you have inflammation between your joint, what are you doing? You're constantly pushing on something called a bursa. It's a fluid-filled sac. You're constantly pushing on that, and it's getting irritated. It's like when you have a blister, right? And it keeps rubbing and rubbing and rubbing. It hurts. It hurts more and more, and you're causing more and more damage every time you take a step. Same thing's happening with arthritis. So you have to target that inflammation. One, why is it there in the first place? That is not something an orthopedic surgeon is going to tell you. You need to go to your primary care doctor. You need to go to a functional medicine doctor, a naturopath, a doctor of osteopathic medicine, somebody who's really focused on nutrition and autoimmune disease, and figure out, okay, why am I in a state of chronic inflammation? Because if you eliminate your chronic inflammation, you can eliminate your arthritis as well.
Right. So yeah, eating less processed foods, eating less like red meats and things like that, it's been affiliated with increasing inflammation in the body. But like Lauren said, you have to kind of weed that out with a doctor, because it also could be stress. Stress could be making your body really inflamed. So these ancient practices I've read in different books often said that arthritis is a disease of not loving yourself in a way. And I don't mean for that to be like stigmatizing or anything, but maybe that's the connection, because I was like, how does that relate? But if you're in a constant state of stress and not taking care of yourself nutritionally or even mentally,
or not allowing yourself to heal from past trauma.
That's a huge one that we're learning now. Like pretending like trauma didn't happen and burying it, or not talking about it, or not doing anything about it is not going to get you anywhere. It stays in your body, and then it will manifest in diseases. So it's like, okay, you don't want to pretend like I'm not here. I'm going to make you deal with it. So it's better to be, proactive than, retroactively treat something like that. So yeah, inflammation has a lot of different causes, and you want to know that it's primarily diet and stress, and that's going to be like for all the diseases we're talking about. So as strange as that sounds, because you've probably never been exposed to that, start thinking about, am I dealing with my stress well? Do I have past trauma that's been unresolved? Could I eat better? Things like that. Should I lose some weight before I just jump to surgery? Surgery is a big deal. So, and then again, this is why I love to tell people, what is the cause of this problem? That's something you should be asking with anything in your life. Any disease you have, any problem you should have, you should be saying, what is the root cause? That's what Eastern practices do, because then you can treat it, and then it's not like just a Band-Aid fix, which I feel like our medical system does a lot of, is just Band-Aid fixes. And we kind of, what we ask for is what we get. So we need to actually take charge of our own lives and our own culture, and stop asking for quick fixes to everything, and maybe being a little bit of a deeper culture and thinking about, well, what's causing our problems? What's causing my problems? And working from there, because from there you can have whole body and whole mind and whole spirit recovery, rather than just a Band-Aid fix.
Well, it's just like that saying, with business, you get out of it what you put in. Same with your body.
Yeah.
I mean, if you're constantly going for the quick fixes, the pills, the surgeries, whatever, then eventually things are going to backfire. Things don't last forever, or you're going to have side effects, or you're putting yourself at risk for other things. So I'm not saying nobody should ever have a knee replacement, but check your other options first, because if you are willing to put in the effort, you may have long-lasting results that eliminate the need for invasive surgery, because it is invasive. It's an intense surgery.
And so we recently discovered in a class that taking like Tylenol all the time and different anti-inflammatory drugs actually decreases your body's natural ability to fight inflammation. So you're actually creating like a cycle of inflammation inadvertently.
Chemical dependency.
Yeah.
And pain and inflammation. And it's a Band-Aid fix, but it's like an addicting one. So it's not okay. And it has side effects. But anyways, okay.
Yeah, sorry. And another thing, too, is water. What a lot of people don't realize is that your joints get dehydrated. Yeah. And that was another factor in my research that I found is like water, but keeping everything lubricated puts less stress on that cartilage and on all those joints and every part of your body. Even it helps support your muscle tissue. If you have like really supple, good muscle tissue, it can support your skeletal structure. So that's another thing too, which I didn't mention, is like strengthening your muscular system can really help reduce your need for a knee replacement, because then there's less stress on the bones because the musculoskeletal system works together. So if your muscles are weak, then your skeletal system has to take up for the lack of support there. So the next thing is the decision-making process, Lauren. So, like we were saying, anti-inflammatory foods, there's a lot of anti-inflammatory foods. Ginger is an anti-inflammatory food. Turmeric is an anti-inflammatory food. And then, like we said, there's inflammatory foods. So red meat was like, what was it, more associated or thirdly associated with behind tobacco and other things that cause cancer. And cancer, we're finding out more information too, is caused from inflammation, just like arthritis. So you want to reduce red meats, reduce processed food, and then have more anti-inflammatory foods. And then you can also research that too, about anti-inflammatory foods. And that can help you. Who knew? Yeah. And then consider non-invasive treatment options. So surgery is like a last resort. So a lot of my patients would come to me and they'd be like, yeah, so I'm going to get this surgery. Like, how do I get this surgery? But that's like not the goal unless you are, beyond the point of no return. So I would say we always try to do conservative treatment first and then go to invasive treatment later. So why? Because there's a lot of risks involved. When you go under anesthesia, they can't anticipate 100% how your brain's going to respond to that. Some people don't wake up. Some people have horrible reactions where...
allergies.
Yeah.
You don't know until you try.
Not to scare you. You shouldn't go in scared, but just go in wise, like knowing, what the risk benefit is. Mm-hmm. And if you can realize this ahead of the game and prevent yourself from having to go in, it's better. So, and then even if you do have to go in, you should be doing all these things anyways that I'm telling you. So even if you're like, I'm getting it next week, it's very severe, I saw the x-rays, you still want to do all these things to improve your chances of success with the surgery. Mm-hmm. And then, so the non-invasive or conservative measures is mild to moderate exercise. So, there's mild to moderate, arthritis, and they found in a study with people that have mild to moderate arthritis in the knees with exercise, they were able to have just as much improvement as the people that actually had the knee replacements. So once it's severe, there's an integral damage. So, but before that, you can start to rebuild your body's cartilage. And what rebuilds your body's cartilage is diet and exercise. And they actually found in studies too that exercise increases your body's immune response, the healthy response, and helps build your immune system. So all those like T cells and all these things going on in the body, like your body's soldiers, it amplifies as you're like doing your workout, even if it's a small workout. So you want to help your body be able to fight off disease and keep it intact. And you can do that through nutrition and exercise. Now, there's injections. Lauren, I'm going to let you talk about injections. I don't like injections as a conservative treatment.
Yeah, I used to be all for the injections. I hurt my neck and I was like, can you just give me an injection and then I'll work on it?
Band-Aid.
No, bad. So injections, when you're dealing with a joint, one of the side effects, one of the things that I don't know if was disclosed to you or not, But if you do get an injection, it can cause stress fractures in the joint, which will make your problem worse. It can cause progression of your arthritis, making your problem worse. And it can cause joint collapse, making your problem significantly worse. Plus, over the years working with patients, it's like a hit or miss, like, I felt good for a couple days or a couple weeks and then it wore off. Or I have people who are like, yeah, it helped for a couple months, but then every time I went in for another injection, it helped less and less. And then I have people who are like, it never helped me ever. They keep doing these injections and they're not doing anything for me. So do you want to take that risk? And maybe you do. That's up to you. But again, talk to your doctor about these risks, because it's not just like, okay, step one, did you try dieting? Didn't work? Okay, here's your injection. Didn't work? Okay, here's surgery. It's just so like 1, 2, 3. Okay, let's have the surgery. But talk to your doctor about these risks, because these are conversations that you need to be having.
And then 2, what I found out that was really interesting is, Lauren, people with diabetes, when they get, injected with the steroids, it increases their reaction. The sugar levels jump. So you have to look at the whole person again, because you have to look at the risk benefit. And if you have other comorbidities besides arthritis, like diabetes, the injections, the steroids, their steroid injections could actually aggravate your body.
Steroids degrade your bone. That's just what they do. And that's like a known fact. Steroids wear away at your bones, which is why you have to be really careful prescribing steroids to kids, because their bones aren't developed yet. But then we're prescribing steroids for people who are having issues with their bones. So it's like, I don't know. I don't get it. Counterintuitive. I mean, if it reduces your pain, it's good to not be in pain, but not if it's worsening your problem, because then you're just creating, again, this cycle of dependence, and you're getting worse and worse and worse while you're just masking symptoms along the way. And it's like, it's ridiculous to me. And again, I used to be a believer. Oh, did you try getting your injection? Like, I wanted injections. And now I'm just like, wow, I wish somebody would have told me.
Yeah, and like she was saying, it weakens the tendons and everything too. So it's just weakening the integrity of your musculoskeletal system then. So it's like, why would you do that?
So then if you do end up having the surgery, I mean, you need to be strong. You have to strengthen yourself before the surgery. So then that's kind of just counterintuitive.
So not a good idea. So we would say no. But it's up to you. We're just giving you information and telling you what we would do if we were in the position. And then the EMF therapy, pulsed electric magnetic field system therapy. So we've talked about that in other videos. So Lauren, you could kind of expand about that too.
Yeah, I mean,
you know more about it than I do.
It just, we are full of electricity. I know we focus on chemicals a lot in our medical system, but we are electrical beings. And this, basically, you lay on a mat, and or there's a wand that you can use over a specific targeted area, and it charges up your cells. So, your cells deplete, they can shrivel, and they're not absorbing as much nutrients, they're not getting the toxins out, they need to be charged electrically. So this charges up your cells, gets them back to full potential so that your cells can get back to what they do best, keeping you healthy, healing, reducing inflammation, all that stuff. So it restores the health of the cells, it reduces inflammation. There have been a ton of people that have literally had surgeries scheduled, tried PEMF, canceled their $50,000 surgery. Nope, I don't need it anymore. So give it a try, find it in your area. They're a little tricky to find because they're not certain people don't want them around because they're working and causing people to cancel surgeries and things. So, but find one. If you want to contact us, I'd be happy to help you out with that too.
It's basically like Star Trek, the tricorder where they're waving it over people. It's the same thing. It's understanding that we're electrical beings and like improving the electrical conduction in the body, which then increases the blood flow. And if you go back to earlier videos or what we were saying even earlier in this video, everything's about circulation because the blood carries the nutrients. The nutrients are the building blocks for the cellular structure. And it also carries oxygen. So the things that you need for healing is nutrients, oxygenation, therefore blood, which carries both. So anything that helps with that is going to help you with pretty much any disease you have, including arthritis. And And then risk and concern. So some risks of surgery. Before any surgery, you should always ask your doctor, what are the risks? And, what is the statistics on how successful the surgery is? And what are your statistics?
And not for one of those glossed over, the commercials you see on TV. Risk of blah, 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 and death. Actually sit down and be like, no, we need to have a conversation about these risks. Back and forth, you say something, I say something back. Don't just spit all this at me and be like information overload I don't even understand. Have a conversation about it.
Especially if you have heart problems, because going under anesthesia, you have to definitely do a risk-benefit assessment, and you should be having a cardiologist evaluate you as well. And then there's always the risk for infection. So I had a friend that was a surgical technician, and there's all these protocols for them to make sure that the patient doesn't get any bacteria on any of the tools that they're using. So the technician hands the tools, there's sterile areas, there's no walk areas, everybody has to wash up. But even with all those things in place, guess what? Not everybody was following the rules because they're human or because they don't care enough like they should. So sometimes, sometimes people cut corners depending on how many people you have scheduled that day or whatever happened with you. So not, again, to freak you out, your body, your immune system is set up to fight infection. But if your immune system is already compromised, which it may be if you have osteoarthritis.
Or it may be because you're putting a foreign object in your body.
That too. So our body is made to heal itself. Okay. So if you have a wound, it heals on its own pretty much, as long as you don't dig it in a lot of bacteria. So your body wants to recover itself. We're putting in a foreign agent into our body. So we're putting titanium to cover those parts where the cartilage was, so that you don't have as much pain when your joint is mobilizing, right? So, but the body is still gonna have potential problems with having foreign substance like that in it that it wasn't designed to have to begin with. I mean, a lot of people do good after surgery, but some people have complications as well. Like I said, if you're having heart problems or you have immune system problems, you could get an infection, and that could lead to death. So you really have to be making sure that you are building up your immune system before surgery. So making sure you exercise and eat well and check your stress. And then you also just have to have that as a consideration that could happen. You could get a life-threatening infection. Now, they do to put protocols in place so that you don't.
Yeah.
But this is a potential thing you need to know.
I mean, it could be minor. If it does get severe, they will have to remove the prosthetic joint. They'll have to take it out.
We've had that.
They'll have to put a spacer in where you literally will not have a knee. You won't be able to walk on it, put any weight on it. And then you'll have something that locks your leg in extension, so your leg's constantly extended, can't put weight on it. Let the infection go away, let everything heal, and then go back in and put in a new joint.
And even after you put in a new joint, it's not forever. A lot of times people need to have, I forgot the exact period of time.
It was 10 years. I don't know if, with new materials and stuff, it's gotten longer, but
the body starts having problems with it and you have to go for surgery again. So I think a lot of patients, even me initially when I first heard about them, thought they were a lifetime fix. You go in, you get it done, you can move again, and bam, you have a 20-year-old knee.
That's why when you're 50 and you need a knee replacement, you really got to think about your other options, because then what? When you're 60 and then when you're 70, I mean, do you
80,
plan on living
90?
a long time? That's a lot of knee replacements. So
we're
not trying to scare you.
No,
we're just trying to
give me
say,
information.
This surgery, it should always be a last resort. I have exhausted all of my other options. I have to have surgery. And 9 times out of 10, probably 999 out of 1,000, people have not exhausted all their other resources because, one, people want a quick fix, like we were saying. People are like, just give me the surgery. It'll be easier. Just give me the surgery. Or two, people don't know all of their other options. So we want, that's why we wanted to go through this, explain your other options and explore them with you and encourage you to research other options.
Yeah. And then, literally when it first is done, you have to wear an immobilizer right after, because your body is not strong enough to bear weight through it. So it's going to take a while for you to be able to you don't just get up the next day. Oh, we're going to talk about that later. And it's painful. So, Okay,
so
the next part.
We talked about all the risks. We wanted to make sure we emphasize that. We're going to go through, okay, you've already decided you're having this knee replacement surgery. What do you do? Because a lot of times we'd come in and our patients would be like, what? I have to stay for therapy? I can't stay. Or what? I thought I was going to be able to do this. Or I don't have... People would panic. I mean, it's an elective surgery, but I don't feel like people are getting the information that they need. Like, hey, this is what to expect. This is what you should do to prepare. This is what is going to happen the next couple weeks. So we want to prepare you so that you can go into your surgery being like, okay, I got everything done. I can focus on my recovery and go home and feel confident.
Know what to expect when you're expecting a knee replacement.
Yes. So, what you should do before your knee replacement: prepare your home, grocery shop, stock up on things, healthy foods, anti-inflammatory foods, a lot of produce. Frozen foods are great because all the nutrients are going to be preserved when you freeze, frozen fruits and vegetables. And then it's stuff that you can just like toss in a steamer basket or toss in a smoothie. Easy things for you to make. You can cook ahead of time and freeze also. And then clean. If you can't clean your house because of your pain and your decreased mobility, have somebody clean the house really well because you're not going to be able to do it for a while. Like that deep cleaning. Do your laundry. Get all of your laundry done. You don't want to have to come home and worry about having dirty clothes to take care of. Or have somebody do it if you're having trouble with it. Rearrange things in your house. This is a big one that people don't realize. So if you are constantly going down to that lower cabinet to get your frying pan out or your pot out or whatever, and you're doing this every day, it may not be a big deal now, but after your knee replacement surgery, it's going to be a little harder depending on your mobility level and how functional your other leg is. If you have a strong if your other leg is strong, you'll probably do better at home. You'll have an easier time getting around. But either way, you want to make things easier on you when you get home so you can focus on your recovery. So move things up. I always say between eye and hip level, that's like your easy access area. So keeping frequently used things on the counter or on the stove, not so that things are cluttered and hard to get around, but just so you have easy access to things that you're going to need.
Yeah.
And then establishing pet care and backup care. This is a huge one. People will come in and be like, you want me to stay for rehab? I can't stay for rehab. I got a dog at home. And then they check themselves out of the hospital before they were ready. So make sure that there's somebody that can take care of your pet or somewhere you can board them. And, the thing is, you may only be in the hospital for 3 days, 2 to 3 days, but they may decide that you need a little rehab and you may be in the hospital for a week or two. Or if you're really struggling, several weeks, depending on what level of rehab you're in. So most insurance companies are pushing for release right away. So most people get out in within 3 days. But, if you're older, if you have mobility issues, if you have other health concerns, complications, expect to be in the hospital for a couple weeks.
Yeah, and you might
go to rehab.
And you might want to consider getting. Most people don't need this after they get a knee replacement, but if you're older and your mobility is really impaired and you're anticipating this is going to be really hard on you, not all hospitals provide this, but it would be good to get it for yourself in advance, like a riser for the toilet to get on and off the toilet, because that can be really dangerous. Like normally we recommend increasing the flexion in your knee and improving the mobility, but I don't recommend it if you're one of those people where you, like I said, are getting older and you're really not that active and you're trying your best to get prepared for this surgery, but it's going to be really hard after. And especially if you have urgency to go to the bathroom, I don't want you rushing to go to the bathroom and then your knee is not working that well and then you're trying to bend. Depending on what your toilet looks like, talk to your therapist about it.
Yeah. So then let's go through the surgery, just real briefly, kind of what the surgery is, what they're doing to your body.
Okay, yeah, so I just kind of briefly talked about this. It's pretty intensive. They are opening you up. You are undergoing anesthesia because they're opening you up, and that would be very traumatic to see awake. And like I said, they are doing a titanium. So this is your femur, and your leg, and then your tibia at the lower leg, and then the joints like this. So they cover it with titanium, where the cartilage has completely or a lot of breakdown is there, and they cover it so that you're able to flex the knee with reduced pain, and you have improved mobility. And then they literally they have to remove your kneecap to do that. So it's look up. You can look up videos. I told a lot of my patients this. You can go on YouTube and watch an entire knee replacement surgery and see exactly what I'm describing, so you're fully prepared to know what they're gonna do. But yeah, they literally have to lift up your kneecap, go in, scrape, and then put in the titanium, and then re-sew you back up, do the stitching. And that's why it's one of the more painful surgeries for people, because it is quite invasive for them to do what they're doing. So they're implanting a foreign device in you. And not to scare you, a lot of people get these done, but we just want you to be fully aware of what they're doing so that you're not surprised, because a lot of my patients would be like, I don't know why I'm having so much pain. I think something's wrong. And don't, always validate your pain, always ask questions, but you're going to have to start moving right away after surgery, even though it's painful. As therapists, you may think that we're a little crazy when we're asking you to do all these things, but we're not. It's because you really need to start mobilizing, and we know it hurts, but it should hurt because of what they did. It's very intensive.
So let's talk about what to expect in the days after surgery, because this is important, because a lot of people wake up and they're just like, I didn't know it was going to be this hard. I didn't know it was going to be this bad. So we're going to tell you, a knee replacement is the most painful orthopedic surgery that you can have. Mm-hmm. That you're going to have pain. You're going to be in a lot of pain. So whatever pain management strategies you use at home, bring them here. Think of new ones. Think outside the box, with meditation and homeopathic medicine. They are going to give you heavy-duty painkillers, but not forever, and you're going to have pain for a long time. So this is something that you need to research in advance to know, okay, these are some things that I can try for pain management.
And I always tell my patients too, even though they're offering, okay, so they're drug happy. In the hospital, think about it, everybody's on 10 medications. Pain medication, the nurse is trained to be like, hey, do you want pain meds? What's your pain level? They have to document on that. That's a part of the protocol. Do not take it unless you have to, because there's secondary complications to taking pain medication, okay? So it's going to be harder later on when you don't have the pain medication, if you were putting yourself on high amounts of it to get off of it. And then also it constipates you. So you're not able to expel the toxins in your body, and you're also not
Plus you're not moving as much, so that's a double whammy.
So a lot of people get impacted, or they get problems with their bowels because they're taking so much pain meds. Mm-hmm. So be very, I'm not saying don't take any at all, but do your best to use your best judgment if you really need it or you don't need it, and expect that you're going to have pain.
Okay, so what is it going to look like? Physically, it's going to be very swollen and red, and that's normal. You will either have stitches or staples. Most of the time they go with staples. If it's a repeat surgery, a lot of times they'll do stitches. The difference, stitches cannot get wet, so you cannot have water touch anywhere in that area until your stitches are removed. With staples, they can get wet. So as long as your incision is no longer seeping, so you will have some drainage from your incision, some stuff coming out, and that's normal, so that's okay. But when that stops, and usually for the most part it should stop within 3 days, then you can get your staples wet, so you can shower without having to cover anything up. But talk to your nurse, make sure everything's okay, make sure they approve it before you go ahead and do that. And you're probably going to want to work with an OT or a nurse to make sure you're safe in the shower. Mm-hmm. So staples or stitches, talk to your doctor about what you're going to get so you know what to expect moving forward. Both of those come out within 2 weeks. And then you're going to have a knee immobilizer. So what that is it's this brace. It's like a soft brace that you'll have to Velcro. I think there's 6 Velcro straps, 3 below the knee, 3 above. It keeps your knee extended. So why do we have this? It's for a couple reasons. One, they tend to do a nerve block during surgery, and that nerve innervates the muscle that extends your leg. So the reason they do the nerve block is for pain management. But when you wake up from surgery, the muscle that extends your leg might still be sleeping a little bit. So until that muscle wakes up, we have to protect you so that you don't fall. Because otherwise you're going to stand up, your leg's going to give out, and you're going to fall down. So That's one reason. Another reason is after injury, your body automatically wants to go in the fetal position, which is like flexion everywhere, curled up in a ball, right? Well, for the knee, that means flexion of the knee. So then you're at risk for things healing in a flexed position, in a bent position, and then you may get to the point where you can't extend your leg fully. So it's very important that we prevent that. We want to go against the body in this case. We do, because your body's going to heal curled up, and we want you to be able to walk with your leg fully extended.
Yeah.
We want
Lengthen
full
the
range
tissues.
of motion of the knee.
Yeah.
So that's another thing to expect. You're going to have physical therapy coming in day one, being like, one, we got to get up and get you walking, but two, we have to work on bending and extending your knee. So 2 goals here. We want to get you to full extension, so 0 degrees. And we want you to get at least to 90 degrees of flexion. So 90 would be like, if a right angle. If you're sitting in a chair, you want to be able to have your foot flat on the floor. So in order to do that, they're going to have to push you, literally push you. You're going to have to push yourself. You're going to have to force it to bend and straighten, and it is painful. It is uncomfortable. And this is why the knee replacement is the most painful of all of them, because you're going to force something that the body does not want to do.
Yeah.
So you're going to have pain. You're going to have inflammation.
A lot of inflammation.
All of that will subside. I would say the first week is definitely the worst. First 2 weeks are pretty painful, and then after that it starts to taper off. But the important thing with pain is the more stiff you are, the more pain you're going to have when you're trying to do things. Because if you're stiff, if you're trying to get dressed, you're bending and straightening your knee. If you're trying to walk, you're bending and straightening your knee. So don't let your joint stiffen up. It will be harder in the morning because obviously you've been sleeping, but try to keep moving throughout the day. So, I know you're in the hospital and you got the nurses to wait on you and stuff, but don't do that. Get yourself up, get yourself moving with the help of your therapist or a nurse, because you don't want to be stuck in bed. You want to get moving the day of surgery. As soon as your anesthesia wears off and you're able to get moving around, you want to start moving.
And try to do breath work when you're doing those exercises that are painful.
Yes.
Focus on your breathing, because your body is natural.
Breathe through it.
Yeah, your natural instinct is to guard your body, just like she was saying, that fetal position. Like, your body is going to start turning inwards and your muscles are going to contract. So if you're trying to move that knee with everything tight, it's going to be fighting against each other. So if you breathe in, breathe out, your body automatically, reflexively relaxes. So then you're not working against your body. You're working with your body, and it helps a lot. One other thing I just want to mention real quick too is you have to watch out for blood clots sometimes after surgery. And so what is a blood clot? It's traveling. It could cause a heart attack, or it could cause a stroke in the brain. So it's really important that...
So a blood clot, I just want to say first, a blood clot can be caused by you not moving the leg. So your blood gets stagnant, it starts to clot, literally form a clot, a chunk of blood. Yeah. And then
it's not able to, travel through whatever blood vessel it's going through. So signs that you have a blood clot, that's causing the pain is it's hot.
I want to explain that a little bit more, though.
Oh, okay.
Can we just start over with the blood clot?
Yeah.
I just want to say, how it develops, and then it breaks. Eventually, the blood flow causes it to break off, and then it travels through your body. And if it gets stuck somewhere, it can either get stuck in your lungs, or it can decrease oxygen to your brain, or whatever.
Yeah. Okay. So
just start over with blood clot.
Okay, so blood clots, what are they? So a lot of times, people that have arteriosclerosis, I described it to them, and a lot of people that have OA, osteoarthritis, have this. So if you think about the lining of the arteries, sometimes it gets clogged with fat or hardening. That's what arteriosclerosis is. That's why it's affected by diet. So if we're eating high fatty foods, that develops. And then sometimes the blood it'll break off from that fat, and it'll develop a clot, and the blood platelets aren't moving appropriately through the vessels, and they're very tiny vessels. So when that breaks off and starts to clot and forms a big enough clot that it blocks the vessel, that's when we start to get things like pulmonary embolisms, in the lungs. There's a blood clot. and the heart.
If it breaks off and travels.
If it breaks off and travels. It can also travel to the brain and cause a stroke. So there's very serious consequences that can happen. And this can happen after surgery because you're more at risk for having a blood clot develop after surgery because of immobility. So your vessels are like contracting and releasing and are healthy when you're moving around, and then the blood is flowing freely a lot when you're moving around. But then when you're immobilized and you're not moving, or you're just having a prolonged period of reduced movement, the blood starts to clot. It's more prone to clotting and more prone to problems, especially if you have arteriosclerosis. So, and especially after you just had a surgery. So that's why it's so important to move earlier on. Mm-hmm. Now, signs and symptoms of a blood clot at the knee, because some of my patients had developed that, is that you'll feel pain in one specific point in the knee. Like a lot of people have pain. Like we said, it's one of the most painful surgeries. There's going to be a huge incision mark and you'll have pain all throughout there. But if you have pain in one specific point and it's tender to the touch and it's actually really hot, those are signs of a blood clot. And redness.
I mean, it'll be red from the surgery, but...
Yeah, those are signs that it could be a blood clot, and please let your nurse or doctor know immediately to avoid those other dire consequences. So that's just something important to note, too.
And you don't want to ignore that, because once you develop... If you do develop a clot... Yes, it's decreasing circulation, but the clot becomes dangerous when you get up and then your muscles start contracting, and then the blood is pumping through faster, because that force from the blood flowing through can break off the clot, and then the clot starts traveling, and that's when it's dangerous, because then it can block blood flow to your brain, or it can settle in your lungs. You obviously don't want blood in your lungs. So that's when it becomes very dangerous. So if you are concerned, don't even get up. Just put your call light on, say something right away, have it checked. And these are things that they're going to check daily, but just, keep an eye on it yourself too. It's good to be informed. Mm-hmm. So, okay. So, discharge. Or actually, let's talk about the knee immobilizer again. Once you can keep your leg extended and raise it up and down while you're lying down 10 times, that's typically the test to see if your muscle is fully engaged and you're strong enough where you don't need your knee immobilizer anymore. Depending on your body, that can happen. I've seen it happen day one. It's very rare. It's usually like 3 or 4 days. Some people, it can take like a week. So typically before discharge, you're going to have that removed and you won't need to go home with it. So let's talk about discharge. In order to be discharged, you have to be able to either get yourself dressed and do your daily activities, or if you have someone at home that's going to be doing stuff for you, then, just saying like, hey, this person's going to help me, and having that person be able to help you. And you need to be able to transfer in and out of bed, on and off the toilet. In and out of the tub or the shower is important, but not necessarily essential, but definitely the toilet in bed. So once you're able to do those things, then you can go home, as long as medically there's nothing keeping you here. Most people, like I said, these days, because of insurance, they're pushing people to go home from the hospital. Some people are going to acute rehabilitation, which they'll stay usually for about a week just to fine-tune everything and make sure they're safe going home, especially people who live alone and don't have help. And then if you're struggling, you're going at a slower pace, which is okay, then you may go to subacute rehab, where you might be there for 2 weeks or so, 2 to 3 weeks, depending on how things are progressing. So... Mm-hmm. And then once you are home, you will have outpatient physical therapy. So they'll work on walking. They want to get you walking with the least restrictive device. So normally you'll start with a walker, go to a cane, hopefully end up with nothing at all. You may end up with a walker permanently, depending on who you are and how things are going. But the goal is the least restrictive device. And they're also going to work on increasing that knee flexion, bending your knee, and extension, straightening your knee. The goal is as much as possible, really. And then when you are at home, you want to make sure you're moving around. Again, because of the blood clots, because of the stiffness, because of functionality, because of your muscles, you want to make sure you're always moving. That's always a goal, to make sure you're moving around as much as possible. But again, you don't want to make things hard on yourself, and you don't want to make things unsafe. So preparing your home ahead of time is very important, and you want to make sure you're always following your physical therapist and occupational therapist safety recommendations and instructions to make sure that you are safe at home and to prevent falls, which will complicate things.
And then what I would do too is, I know it's hard, but even before getting the knee replacement, I would just be trying to move my knee, to get as much mobility prior to the surgery as possible. Because if you get it nice and flexible, or a little bit more flexible before all that swelling and surgical pain takes place, you're going to have a higher probability of reaching your targets for rehab.
And some doctors will prescribe this, some won't. Usually, again, surgery is the last option, so you go with more conservative things first, and one of those is physical therapy. So if your doctor didn't mention this to you, I would ask about physical therapy beforehand, because yes, you're trying to prevent the surgery, but also if you know you're getting the surgery, it's important to work on strengthening the muscles that you're going to need after surgery, and also strengthening your upper body, because you're going to have to compensate a little bit. So it's good to get your body prepared for surgery so that you have the best outcome possible, because evidence has shown people who are stronger before surgery have an easier recovery.
Oh, and fun fact of the week, I found this out later in life. Even just making sure that your joints are warm when you have osteoarthritis and you have like knee problems, before surgery and after surgery, making sure you're wearing clothing in the winter time that keeps the circulation going, because arthritis is also contributed by poor circulation, like we said, so your clothing can actually affect your outcomes as well. So stay warm.
Cold constricts the blood vessels, so you don't have as much blood flow. So if you're keeping everything nice and warm, blood's flowing, circulation, good for you.
Yeah, so I think that sums up our video. I hope you enjoyed it. I don't think that there's anything else that we have to say. We were pretty comprehensive, maybe a little too comprehensive, but we just want to give you all the information we know so that you're as comfortable and successful as you can be. And then Lauren is just going to talk to you about things you can do to make sure you stay tuned to more videos.
Yeah, so please like our video, share our video with other people if you know someone who's having trouble with their knee, even in early stages, because like we said, the diet and exercise is important to get on board with right away. Share our video, subscribe to our channel so you can catch our other videos. And we have several playlists where we have other videos on wellness too. So even if you're not having any health concerns, you can check out those different playlists. And then visit us at www.facebook.com/Lauren and Tracy. So we always post our videos there. Sometimes we have articles and things that you can reference. And then if you do have any questions, feel free to email us. If you have questions about the nutritional product that we recommend to help you stay well and improve your health, just send us an email at alive2thriveot@gmail.com.
And we are, as always, wishing you spiritual, emotional, and physical health. And we are very appreciative for you to spend your time with us. So thank you.
Take care and good luck with your knee.
Bye.